Hi, this is Dr. Marshall Partington here at Partington Plastic Surgery in Kirkland, Washington. And today we are operating on this lovely young lady who is actually an international supermodel. Who is Miss Canada. She's in for a number of procedures today, including liposuction, breast augmentation, and rhinoplasty. What we wanted to do to demonstrate this is that I wanted to show you the markings and emphasize how our goal here is to not make major changes because she's already beautiful, but to just address her specific concerns about her contour, which in her case is very fine-tuned. So as you can see here, we're doing an area, we call this, part of this is hip, this is outer thigh, and this is the so-called banana roll, which is down below the crease of the buttock. And she's concerned about a little fullness here, as well as a little bit of a contour change between the rest of her thigh and this area here. Here where I've done hatch marks here, these are areas that are indentations, which are natural and beautiful indentations, natural landmarks. We don't want to overemphasize those, so we've got a little topography marking here so that I can steer around these and be sure I don't make pre-existing areas more accentuated that we don't want to touch. So we'll take a little fullness off here to try and get a perfect line between her waist, which is tight and very contoured, and this indentation of her hip, and make this a very smooth line. And also just take a little bit off of her lateral thigh. This is actually where I'm going to concentrate most because she does have a little discernible bump in that banana roll on this side. I've made 2 incisions here and here. She's actually had liposuction in the past in Canada, and we're just trying to work with those incisions using the same old incisions. And what I've done first, actually, just before this taping, I've actually used a very thin cannula, blunt cannula, which I've insinuated into these holes and sprayed the numbing medicine. So this is clear tumescent fluid, or lidocaine, dilute lidocaine with epinephrine, and this will give a vasoconstriction and a numbness. Our patient is under anesthesia right now and is under conscious sedation, but were we to ask her to move right now, she could lie on her back. So she's awake and responsive to commands, but is very comfortable. Yeah. So at any rate, in just a moment I'll show you what that looks like when we use a small cannula of this size. Very small because we're doing fine work, so a small cannula is really important in this kind of sculpting. And we'll show you what that looks like in a moment. Hi there, so we're back and we're just putting some more tumescent fluid in here. And just wanted to check in with our patient. Kassar, how are you feeling?
Good.
Good, everything okay? Are you having any discomfort, any pain?
No, I'm fine.
Good, you're doing so well. Yeah, I'm just numbing these areas up, and after that we'll do the liposuction. We've already done it on the other side, so we're more than halfway here. Okay? Yeah, okay, well I'll let you get some rest, and you're doing just great. You're being such a good patient. Okay? All right, we'll come back to that. So now we've waited some time to allow this to get very numb and also to constrict down those blood vessels so we don't anticipate losing much blood with this procedure at all. And I'm going to first go through this with a cannula, special kind of cannula where I'm doing pre-tunneling and what we term safe liposuction, safe standing for S-A-F-E. This is the S portion of the liposuction technique, which is the separation. So I'm using this cannula to just help separate the fat a bit. Sometimes we will use a basket cannula. In her case, I want to be careful not to disrupt the fibers of the banana roll because that can cause problems with the contour of the inferior portion of the buttock where it joins the thigh. So I'm using a special cannula for that. And we're just going to create our tunnel so we know exactly where to go once we apply the suction to the cannula. Kassar is comfortable, doing just great. And again, I want to stay out of certain areas and I want to concentrate on other areas. So I've made my topographic map here. Okay, so we're back, and what we're going to do now that this area is all too messed, is I'm going to actually do the aspiration of the fat now, which is the A part of SAFE, lipo, S-A-F-E. Turn this section on, please. And we're just going to pass this through carefully in our predetermined tunnels.
Okay.
You see fat coming out here. And we want to just do small amounts at a time and then stop and see what it looks like. Because the trick here is to not over resect. As I say, you can always do more, but it's a whole different game putting it back in. And we do that on occasion, put the fat back in terms of using some of the fat we take out of liposuction to place in other areas. Sometimes we'll put it in the buttock for a little more fullness in the buttock, or indeed we even do on occasion breast augmentation, putting fat back in. Of course, people are familiar with using fat for lip augmentation and for filling in creases in the face. So it's precious material. And we just want to be sure we don't over-resect at any time. Subtle changes, that's